Hello everyone, welcome to my YouTube channel Logic Medico. Today's interesting topic is MCQs on COVID-19, the part 2 regarding the coronavirus. So let's see these MCQs. Coronavirus is called so because of dash on their surface. Your options are beak like spikes, crown like spikes, drumstick like spikes, thorn like spikes. Your time starts now. So the correct answer is the coronavirus. Corona means crown like. Okay, corona means crown like. So that is the meaning of corona because it has got a crown like spikes. In ancient age, this is how the spikes used to be there on the crowns of a king or a queen. Okay, so that is the meaning of coronavirus literally because of crown like spikes it has got its name coronavirus. How does the coronavirus spreads from person to person? Interesting. By touch or by droplets or when the person speaks or all of the above. Time starts now. So the coronavirus spreads from person to person by all of these above methods. Okay. So what happens whenever a person coughs or sneezes, there will be micro particles which are called as droplets. Even when most individuals speaks, these kind of droplets will be liberated. When these droplets are inhaled by the other person or it touches the orifice in the head and neck, that is openings in the head and neck, that is either is nostrils or is mouth. So these droplets are inhaled or swallowed by the normal person, healthy person. So if his immunity is down, definitely he'll contract the infection and suffer from illness. So accidentally these droplets, whenever the person coughs or sneezes or when he speaks, if it falls on certain objects like any material like the desk or a chair or grills, any metal object or any object, if these droplets fall on that, it will survive for nearly, depending on the object, it will survive approximately on average 6 to 12 hours. That range it will survive. So if a normal person touches that area and then he touches his eyes or nose or mouth, that time the droplets indirectly is being transmitted into a healthy person. So therefore even the touch, that is the logic behind washing the hands frequently with detergent solution or a soap water or sanitizing your hand with a alcohol based sanitizer, so that even if you touch some surface which contains the droplets of the infected person filled with coronavirus, now you use a sanitizer now, so it will kill the coronavirus. Even if you reach your hand, it should not reach your surfaces, the eye or the nose or the mouth, your mucosal surfaces should not reach. So that is the idea behind sanitizing the hand. Okay, so that is how the coronavirus spreads. Next question. Separating people who are not ill themselves but may have been exposed to COVID-19 is called as. Your options are social distancing, personal protection, quarantine, isolation. Your time starts now. So if you are told option C, then you would have been correct answer. Quarantine. So more often than not, majority of the news channels use the word quarantine. So what exactly quarantine means? See, whenever a person travels from a different area, okay, where he has been, may or may not be exposed, but more often than not we believe that he has been exposed, he or she has been exposed to COVID-19. So what happens? This person, when he comes in contact with a normal person, so he may spread the disease. So therefore it is important to separating these people who are exposed to COVID-19 but they are not actually suffering from illness. Quarantine them or segregate them in separate room, either in a hospital or in the home, so that they should not be having any contact with their family members. So that step is called quarantine. This is to prevent the spread of infection from the exposed person to the other family members or other persons in the community. Therefore, it is essential for those persons who have a travel history, who have traveled from an area where infected patients would have been there, including the doctor, they should actually undergo quarantine. So that for the next 7 to 14 days, if they don't develop any symptoms, that means they are not having COVID-19 in their body, they are COVID-19 negative, then they are free to roam around anywhere in the world. So that is the purpose of quarantine. If they move on after being negative, if they go to one more new area, again there also they should undergo quarantine to show that they are negative of COVID-19. Okay. Next, what type of virus is coronavirus? Options are single stranded RNA virus, double stranded RNA virus, double stranded DNA virus, single stranded DNA virus. Your time starts now. If you have told this option, single stranded RNA virus, then you have told the correct answer. So how to remember this coronavirus as a single stranded RNA virus? I will show you. This is the coronavirus. So please see which alphabets I have highlighted here. Yes, this means single stranded. Okay, so here corona, here only clue is there, RNA. So it is a single stranded RNA virus. Okay, so the genetic material within this virus is a RNA, that is ribonucleic acid. Therefore it's called RNA virus, and that genetic material is of single strand, means like one hair or a thread. So therefore it's called single stranded RNA virus. So coronavirus is a single stranded RNA virus. Next question. You must have heard of this mask, N95 mask. So what exactly is the meaning of the word N or the alphabet N? Your options are not resistant to oil, not permits the virus, not reusable, not porous. Your time starts now. The correct answer is option A, not resistant to oil. So this mask is not resistant to oil. So what is the meaning of that, not resistant to oil? Okay, it does not filter oily particles. You must have noticed by wearing this N95 mask also, if any substance like petroleum products or anything acetone based substance, you can actually smell them because it does not filter those oil particles that will pass through easily the oil dissolved substance, and you can get the smell of such oily particles. That's the meaning of not resistant to oil. N. Okay, N in the N95 mask. So got this. Next question is again based on N95 mask. What is the meaning of 95? Of course, there is a 95% chances of protection against the virus, but what is the particle size? 95% chance of protection against dash particle size. Your options are 0.3 millimeter, 0.3 micrometer, 0.3 nanometer, 0.3 picometer. Milli means 10 to the power of minus 3. I'll give you clue. Micro means 10 to the power of minus 6. Nano means 10 to the power of minus 9. Pico means 10 to the power of minus 12. Your time starts now. The correct answer is option B, 0.3 micrometer, meaning 10 to the power of minus 6 meters. So it is almost 1 millionth of a meter. Okay, so the meaning of N95 mask is N for not resistant to oil. 95 means 95% of chances it will protect against a virus particle, which is 1 millionth of a meter. 0.3 into 1 millionth of a meter. Okay, that is the meaning of that. Okay, we'll see what it does. The next question, question number 7. Size of the coronavirus is. Your options are 0.125 nanometer, 1.25 nanometer, 12.5 nanometer, 125 nanometer. Your time starts now. So, what do you think is the answer? The correct answer is option D. Okay, 125 nanometer is the size of this. So you might have confused. Just now I told you the particle size which the N95 mask can break is 0.3 micrometer. Suddenly I am telling this in nanometer. That is 125 nanometer. This is 10 to the power of minus 9 nano. Okay, that was 10 to the power of minus 6. So the particle size in simpler word is 125 nanometer. But if you want the decimal point, you can put that. You can convert nanometer into micrometer if you want. Then you can put 3 numbers in front, 1 decimal. Okay, then now it becomes 10 to the power of minus 6. 0.125 micrometer. Please note, in MCQ based examination they can give like this to confuse you. You should always note what is the units. So 0.125 may be correct. You may be thinking this is correct, but it is not nanometer, it is micrometer. 0.125 micrometer. If you want in nanometer to convert in 10 to the power of minus 9, then you make it 125 nanometer. Kindly remember this. Particle size of the coronavirus is 125 nanometer or 0.125 micrometer. Next question. How many spikes does the coronavirus has on its surface? Interesting question. Option 34, 54, 74, 94. The time starts now. So what is it? 34, 54, 74, 94. If you are told option C 74, then you are told the correct answer. So there are so many, we can't count how many are there. It's 3-dimensional. It is a spherical, okay, in structure. So that side also it will be there. So it is 74 spikes will be there on the surface of the coronavirus. So the spikes on the coronavirus, which I just now told you, is made up of what? Options: cold agglutinin, hemagglutinin esterase, warm agglutinin, hemagglutinin lyase. Time starts now. So cold agglutinin or hemagglutinin esterase, warm agglutinin or hemagglutinin lyase. See, whenever there are two options like this, hemagglutinin esterase, lyase, they're trying to give you a clue. It should be one among these two, B or D. So which is that? If you're told option B, then you're told the correct answer. This coronavirus, the spikes are hemagglutinin esterase enzymes will be there on the surface. Okay, hemagglutinin esterase is the correct answer. Social distancing. What is the minimum distance? Your options are 0.5 meter, 1 meter, 1.5 meter, 2 meters. Your time starts now. Social distancing, that is the distance between the two persons which they have to maintain in any social gathering or outside. They are going outside their home. The minimum distance is option B, 1 meter. Now they are recommending minimum 2 meter, but for MCQs the minimum distance means it's actually 1 meter, which is equivalent to 6 feet. Okay. Separating people who are ill with symptoms of COVID-19 is called as social distancing, personal protection, quarantine, isolation. Your time starts now. So note the question again. Separating people who are ill, okay, they are having COVID-19 positive. Why we separate such people? In order to spread the infection to other people. Okay, so this separation has to be done in the hospital in a ward called as isolation ward. It's called COVID-19 isolation ward. So the option D is the correct answer. We have to isolate the patient from the rest of the world or rest of the people community so that they don't spread the infection to others when they have come COVID-19 positive or when they are ill with COVID-19. So that is called as isolation. That is different from quarantine. Okay, quarantine means the person who has got travel history, he may not be suffering from the illness, but he might have got exposed to COVID-19, so we are suspecting him or her for having disease, but we are not sure. So 14 days minimum they should quarantine themselves in a room so that they prevent the spread of the infection to their family members or the community. That is, the person who does not have illness, that is called quarantine, but who has got illness and COVID-19 positive, they have to have isolated in a hospital in isolation ward and take appropriate treatment so that they become COVID-19 negative. They should become COVID-19 negative. 2 throat swabs are taken at an interval of 12 hours, and if it both comes negative, then they will be discharged from the hospital. Which is the receptor for coronavirus entry into the cell? Question number 12. Your options are metallolipase, metalloprotease, metallosaccharidase, all of the above. Time starts now. Time up. So the receptor for the coronavirus entry into a cell, into the human cell, there will be some receptor on the human cell. Is it metallolipase, protease, saccharide? So definitely it is metallo, one of these. So if you have chosen option B, then you have told the correct answer. The metalloprotease receptors we have on the cell for other function, but now the COVID-19 or the coronavirus utilizes that metalloprotease receptor to gain access into the cell, human cell. Okay, which is the co-receptor for coronavirus entry into the cell? Again, this co-receptor helps the actual receptor. Okay, so like a co-worker. Okay, N-acetylcysteine, your options: N-acetyluramic acid, N-acetyltyrosine, N-acetylglutamate, N-acetylglucosamine are the options. Time starts now. So the correct answer is this one, option B, N-acetyluramic acid. In simplest mnemonic, if you want, you can remember as NAMA, N-A, N-A, na, sorry, I told NAMA, N-A, na. Okay, in our South Indian this thing, Nana means in Telugu means dad. Okay, so that may be the mnemonic you can remember, N-A, na, like that. A newborn baby also, 2 months old child also will babble some sounds like na, like that. You can remember. N-acetyluramic acid is a co-receptor for coronavirus entry into the human cell. Coronavirus, after entering the human cell, it first produces what? Option: protein N, protein M, RNA polymerase, subgenomic RNAs. Your time starts now. So if you picked on this option, option C, then you have told the correct answer. So what happens once the coronavirus gains access into the cell with the help of NANA, N-acetyluramic acid, and with metalloprotease, it starts producing this enzyme RNA polymerase. The negative strand of this coronavirus will now start producing positive strands. Okay, single stranded RNA will now replicate multiple RNA copies. Subsequently, it produces protein N and protein M. Ultimately, it produces many number of replicas of RNA. Ultimately, the cell will rupture, releasing more number of RNAs to infect new cells. That is what is going to happen. So firstly, it activates this enzyme RNA polymerase enzyme is the one which this RNA of the coronavirus, RNA in the coronavirus, starts producing this protein called as RNA polymerase. Okay, the genomic size of coronavirus is dash to dash kilobases. Your options you can see 26 to 31. I'll just see the first. Don't worry about the decimal. 26 to 31, 20 to 35, 16 to 32, 23 to 30. Your time starts now. The correct answer is option A, 26 to 31. Okay, remember this 26 and 31. These two dates in the month you have to remember. Okay, very important month for taking decision by every government. At the end of the month they will take decision now, so that you can remember. 26 to 31 kilobases are the genomic size of the coronavirus. Okay, next, last question for today. It's a bonus question. All are symptoms of coronavirus except your options are fever, tiredness, dry cough, body aches and pains, nasal congestion, running nose, sore throat, difficulty in breathing, diarrhea. Your time starts now. In fact, all of these are symptoms. All of the boys answer. All of these are symptoms of coronavirus. Okay, there may be atypical presentations of coronavirus, and some of the patient may not have symptom at all. They are called as asymptomatic carriers. So it becomes difficult for any government to do a throat swab and PCR and RT-PCR and all for all the persons, so that we can't isolate. Only those persons with symptoms will seek attention or medical attention. So, but the person, this coronavirus is causing disease, and asymptomatic carriers are becoming more, and they will spread the infection to the immunocompromised or the persons with extremes of age whose immunity is down. So they will contract the infection and they'll suffer the illness. But the asymptomatic carriers, they have the coronavirus with them, but as the name suggests, asymptomatic, they don't have any symptoms. So they start spreading the infection. That's how it becomes really difficult to screen the entire community for whether they have coronavirus or COVID-19 positive, or they don't have coronavirus. Okay, like and share this video with your family and friends. Don't forget to press the thumbs up button, give it a like, share it with your friends too. Subscribe to my channel if you're not yet done, and press the bell button to get the latest notification. So subscribe to my channel Logic Medico. Thank you once again for watching this video.